15 minutes past 9 Central African time. You're still tuned in to News and Views with myself, Salalo Makwidiri. And our next conversation takes us to Zanzibar, where there's around 150 children who are waiting for a specialist heart treatment. That says medical teams work to strengthen the pathway from diagnosis to surgery and long term care in that part of the continent. And the initiative, which I was reading a bit about it, it's a very, very important and I think a really wonderful one. It involves South African and Tanzanian medical organizations with equipment already delivered through Humanity's Ramadan campaign. And joining us from Humaniti International is Global Ambassador, former Ambassador Ebrahim Rasool. Ambassador, good morning. Thank you so much for joining us. Always a pleasure having you on Salam Media.
Good morning and salams to all your listeners, and thank you very much for this opportunity.
No, pleasure is all ours. I want to kickstart the conversation by maybe getting a sense and an idea of what this campaign is all about, who are the people that are involved, and where was the need that you guys saw and thought, well, maybe something like this could help, especially for young children.
So when we arrived in Zambia at the invitation of the Vice President of Tanzania, who is also one of the chief ministers of Zanzibar, he said that there's a big health problem. We came here, we saw that there was an unusually high rate of children, infants dying of heart diseases. They turn blue, they turn pink, and then they pass on. And it was on average about 38 to 42 children per 1,000 live births that had congenital heart diseases. And we thought that's probably one of the expertises with South Africa having pioneered heart surgery. That's one of the expertises that South Africa can do through the Humanity Foundation that is based in Canada. And so we understood that it wasn't simply a matter of did they have hospitals? Did they have nurses? Did they have doctors, etc.? It was largely that they did not have the equipment for an early diagnosis of the problem, like we have in South Africa. We take it for granted. It was that they're not able to pick up that the child has a heart problem. They only see it when the child turns blue or the child turns pink. And therefore, we are sitting with the situation as it is now. And therefore, we decided that we are going to procure the necessary equipment. And so we came back to South Africa. We met with the Islamic Medical Association. We met with some of the key ulama. Sheikh Ibrahim Gabriels is here with us. We had Maulana Bam supporting us. And most importantly, we had the president of the United Ulama Council, Maulana Abdul Khalik Ali, also supporting us. And that's how we launched the Ramadan campaign. And we said, let us raise the money, the deposit on that equipment, and use that credibility in order, for example, to raise more money globally. And alhamdulillah, we raised close to 400,000 US dollars across the world with South Africa's major deposit coming in. We were able to buy Dopplers, we were able to buy handheld monitors, we were able to buy echocardiograms and all of those kind of things. And it got delivered here in June. And yesterday, we took it to the key hospitals in which all the children who show murmurs of the heart, who show slowness in breath, who show signs of struggling, they will be referred there. And now, as we speak now, we are training 20 doctors, nurses, technicians, radiologists, everyone in the use of that equipment, so that inshallah, in 3 months' time, the children of Zanzibar will have a way to understand what is happening to their hearts.
And you mentioned something quite important, because I was thinking to myself, why would, a little island like Zanzibar have such a big problem of small children with heart disease? It's not something that we see so often here in South Africa, but you mentioned that we have the privilege of early detection. I think if you can stress on that, and just to stress the point of why so many small babies essentially were struggling with this issue.
So, my brother, when our son was born, Tanweer was born in 1999. He turned blue after 6 hours. We were at a hospital where all the equipment was present, all the pediatric cardiology surgeons were present, and his life could be saved within those critical hours. And that's because there was an early diagnosis and therefore there could be an early intervention. Unfortunately, that is not the case in a place like Zanzibar because the equipment to detect it is not here. And therefore, the emphasis on getting the equipment and training the personnel to use the equipment. We even met yesterday and led by Sheikh Ebrahim Gabriels from the Ulama fraternity with members of the Zanzibari clergy, with members of both the ulama as well as the Christian churches and the community leaders. We spoke about how to disseminate the early signs of heart distress in children, and hopefully, inshallah, as Sheikh Ibrahim Gabriel at this moment is out meeting the Mufti of Zanzibar in order for us to spread the signs of heart distress so that early on the children could be referred to that particular hospital, and the problem can be picked up, and those that need help can be referred to the right help, even if it means us receiving some of the critical cases in South Africa for heart surgery.
And all of this requires a lot of cooperation, and I'm just trying to imagine, as this is a South African-led effort, obviously in partnership with the Tanzanian institutions, what does it look like? How have they been receiving this very, very much needed assistance?
Oh, we have had an appreciation meeting with the president of Zanzibar, who simply wanted to meet us and to give thanks that we are doing this. We have met with the vice president of Tanzania. We have met with the minister of health, and we have been received at the highest level. And as I said, even today, the Mufti of Zanzibar is meeting with Sheikh Ibrahim Gabriels in order to express that shukr and that gratitude for what is being done. But we also have representatives of the Islamic Medical Association of South Africa, as well as the Federation of Islamic Medical Associations globally, all with us here. And we are now already getting pledges of how IMAs globally can be assisting us. We have a very good partner in Tanzania, in East Africa, called JKCI, the Cardiac Institute of East Africa. They are doing the training with the staff. And then we have the Doris Mollel Foundation, who is dedicated to picking up premature babies and babies in distress. They are a partner. And wallahi, the Ministry of Health has given us transport, has given us open access to the hospitals and to the staff and the nurses and everyone else. And so it takes an enormous partnership, and led by the Humaniti Foundation that is based in Toronto, Canada. And I am so happy that I give them 12 days a month to lead their programs in sub-Saharan Africa, because this is absolutely meaningful work. And it actually takes me back to my first job that I had in government in 1994, when I was asked to be the Minister of Health in the Western Cape.
And how's that been? You know, getting reminded of the work that you've been doing in the health space after being in diplomacy for a very, very long time now. I'm sure it's very, very refreshing.
No, absolutely. Alhamdulillah, I must say that I could go to everyone who worked with me during that 94 to 98 period when I was the Minister of Health in the Western Cape. I could phone up Dr. Farid Abdullah, who was my chief of my strategic management team, and say, how do we solve this? I could go to doctors. I could go to public health specialists. I met with the head of pediatrics at the Red Cross Children's Hospital, cardiac pediatrics, Dr. Liesel Zulke. Excellent advice that was given. And so I feel very confident that here the real picture of what South Africans are doing for other Africans is not March and March.
Mm.
It is not the anger and the hostility. It is these kind of efforts of ordinary South Africans reaching out to other Africans, being a benefit to the continent. That's the majority picture that we should be sending to the world, not the angry march that we see and the casualties that come with this. It's the life saving that I think we are capable of doing from South Africa for the rest of the continent.
The true spirit of Ubuntu. When you think of initiatives like this one, and I think this is where humanitarian work has almost evolved over the years, is people now start moving beyond those once-off donations and are looking towards more sustainable partnerships. And in this case, I see you went a similar route. Was this intentional, to make sure that you have this equipment taken to Tanzania, to Zanzibar, and ultimately having the local health authorities themselves being trained and working with them and helping these babies? How important was that aspect? Instead of just sending South African doctors, they having them do the work and then ultimately have them come home and then leaving the other children, the other babies, essentially by themselves.
My brother, this is the business model of the Humanity Foundation, and we call it business unusual. We are not there to solve a short-term problem. We are here to leave a long-term, sustainable, systemic legacy on the African continent. When we leave after phase 2, the Zanzibaris will have, hopefully, inshallah, a center of excellence for pediatric cardiology right here. And we built it in East Africa. We went to Sudan, and we are now identifying how to rebuild maternal and child health facilities after the war has devastated it. We have just been the guests of Sheikh Mahdi Sisi and the Tijani movement in Senegal. We went to Kaolack, and again, we are investing in a hospital that serves Senegal, Guinea-Conakry, and the Gambia, and hopefully not bringing in doctors only to and medicines and so forth, but to leave a facility behind that can look after people. And so that is the model that we are using, and you've identified absolutely correctly how it is that we work as the Humanity Foundation. It is the fishing rod and not just the fish.
And from now onwards, what's needed, from various governments on the continent, from medical professionals that want to, get involved, from ordinary civilians, people like myself who want to make sure that this initiative does continue, and that these children actually receive the treatment that they need and that they deserve.
So when we come back to South Africa, and hopefully, inshallah, in September, after 1 year, and after having asked South Africans to donate, we, as the Humanity Foundation, are going to give a full report in almost the way that I'm giving to you. How much money did we raise? What did we do? How is it working? So that they know that the money they gave us is being used properly, and that we who ask them for the money are accountable. Inshallah, we are hoping to set up the next Ramadan campaign. We will look between Senegal and Sudan, what is the most deserving, and we will again ask. But we have also had offers of, for example, some of the Muslim women gynecologists in South Africa. Can they come on a mission, for example, to eliminate backlogs in antenatal screening? We have dentists coming in to make sure that pediatric dentistry is sorted out and that we can do those kind of things. So I think that there is a role for giving short-term fish, but our preferred path is to build a long-term rod that can make Africans self-sufficient. And I think African governments are ready for it, precisely because Donald Trump has punished Africa by defunding the USAID and closing it, defunding PEPFAR, defunding the World Health Organizations. So a lot of money was coming from such institutions. Now that President Trump has pulled the rug from under us, we need to build the capacity of Africans in terms of infrastructure, equipment, and human resource development. And that's a role that I think humanity is playing. And that is the role that I think South African professionals and we've got the Islamic Medical Association and others with us, I think we can really make this a way to reduce Africa's dependency on Western funding.
There you go, Ambassador Ebrahim Rasool. Hey, before I let you go, Ambassador, is this the circles that we'll be seeing you more in, doing humanitarian work, and you've left the life of being a diplomat behind you?
12 days a month, inshallah, you will see me in this. But for example, next month, I hope to go to Syria, and then my more political work of advising on statecraft, on nation building, on transitional management for the Syrian government. That's the other work that I do as the head of the World for All Foundation, which is my foundation to continue my political and diplomatic legacy, inshallah.
Hope to chat to you on that, because the transition in Syria, I think, is very, very important. And I hope we chat again soon. Thank you so much.
Jazakumullah khair. All the best and salams to you all.
I mean, Ambassador Ebrahim Rasool, Global Ambassador at Humaniti International, speaking to us from Zanzibar about the children awaiting specialist heart treatment and efforts to build a more sustainable system of pediatric cardiac care. Yeah, interesting conversation. He seems a bit more lively and energetic, man. It looks like the humanitarian space is one that he enjoys quite a lot. He used to be quite stressed while he was ambassador of South Africa to the US. Going to take a quick break. We'll be back with you after this.